Hello, everyone, and welcome to The Experts with Dr. Janelle Kim. I cannot even tell you how grateful I am to have my guest on right now. It's Dr. Joel Gator, who we were just discussing. We can't even remember exactly, but we've known each other for, let's say, 10 years.
About.
Which is really special. I'm not going to spend all of the time talking about this by any means, but it's really special. I don't know if I've had the chance to tell you this, to kind of watch each other on this journey, because I know that we root and care about the same thing, the foundation of it all. But to see you grow, I mean, it's amazing. So without further ado, I would like to read a bio about you, tell everyone a little bit more about you if for some reason they don't know who you are, which would be crazy. Okay, so Dr. Joel Warsh, also known as Dr. Joel Gator from his popular parenting Instagram, is a board-certified pediatrician in Los Angeles, specializing in parenting, wellness, and integrative medicine. He is the author of multiple books, including the amazing, seriously, Between a Shot and a Hard Place, tackling difficult vaccine questions with balance, data, and clarity. As a parent, I cannot even tell you. Okay. Originally from Toronto, a fellow Canadian through Craig, he earned a master's degree in oh my gosh, I knew this would happen. Epidemiology before his medical degree from Thomas Jefferson Medical College. He trained in pediatric medicine at Children's Hospital of Los Angeles, later practicing in Beverly Hills before founding Integrative Pediatrics. Dr. Gator has published research on childhood injuries, obesity, and physical activity, and has been featured in documentaries, films, podcasts, and major media outlets as a trusted voice on children's health and modern parenting. He has also played a very important role in MAHA, which we will definitely talk about a little bit more later. So here we are.
Thanks for having me on.
Begin. Oh my gosh, are you kidding? I've been waiting for this. And I really also just want to take a moment as a parent to tell you how much I think I talk about you every single day. I really mean it, because you have, for a very long time now, spoken out, in my humble opinion, with grace and balance, but really talking about a lot of topics that it's very difficult to find places. You know, coming from my background, I am grateful to be able to calm myself, to find balance in situations, have an understanding of the human mind and body. But I'm really gone to you a lot, and I'm really grateful as a parent.
Well, thank you. I mean, that's the same for me too. I always try to be as balanced as I can. And
yes.
You mentioned MAHA, and it's interesting because we go back and we were talking about this stuff well before MAHA ever existed.
Yes.
I was talking about kids' health 10 years ago, more than that. I've been a pediatrician for a while.
Yes.
And this topic really just became, I guess, popular or in the news in the last year because
Yes.
it became somewhat political. It shouldn't be political.
Thank you for saying that. Take the words out of my mouth.
Even, people say, oh, you're part of MAHA, whatever. I'm like, I don't even know what that really means exactly.
What does that mean?
I'm just doing the same thing exactly what I did before, but it is nice to see people talking about it more. So I think that's good. And I'm always happy to be involved. I'm not political. I'm Canadian. I'm American now, just recently, but I couldn't even, vote until recently. So it's not on one side or the other. It's really just good to see that we are talking about these things, because we do need to talk about them, because our kids have a chronic disease epidemic, and I think we can agree to that now. And that's what MAHA has brought out, which is good. We don't always all agree on solutions to everything, or maybe the exact direction of what we should do. But ultimately, it's good that we're talking about it. And, we used to talk about this years ago, but we even back then couldn't talk about vaccines.
Yes.
And that always frustrated me, because, of course, I talk about it in the office, but it was so censored that you just really couldn't talk about it very much online. I never did. If I was on shows or podcasts or whatever it was, I always said, oh, no, let's talk about anything, but just not that.
I get it.
And we just couldn't. And I'm really got frustrated during the pandemic. I thought it was really important that we need to be talking about this. And that's why I wrote the book. It's not about being pro-vaccine or anti-vaccine. It's not about telling people what to do. I don't believe doctors should be telling people what to do. I don't think anyone should be forced to do anything, but we should be able to talk about it. We should be able to get the best information that's available so we can make the best decisions for us. And that's why I decided to write it. And luckily, I guess the environment has changed a little bit, and we are able to talk about it a bit more, and I've been able to, which is great.
Yes.
And I've been shocked, because I thought I was going to get censored and kicked off everything.
I mean, you're saying so many things, and I'm just taking it all in, but you touched on so many amazing points. First, I just want to highlight that I love that you say that anyone and everyone who knows me and my Taoist lineage, and just, we all make our own choices. So I love that you say that. And as a doctor, as any kind of expert, we're on the experts. I do agree that it is, we come to people who have a lot of experience, who truly care as guides, right? But at the end of the day, you make the choice. So you really can't put a blame on anyone else ever for anything, really.
Right. And that's what I feel like my role is as a doctor. I mean, that's what it's always been.
Yes.
Literally, the word doctor means to teach, right?
Yes.
Docere means to teach. And that's the way it always was. And that's the way it is with the rest of medicine.
Yes.
But with this one topic, it seems like it's moved from teaching and discussions to like my way or the highway. Do it or you can't go to school. Do it or you're kicked out of my office.
Yes.
And we've seen that boil over into
listen,
the frustration.
It's not something I say all the time. We don't have to get into detail, but I was at one point shut down on Instagram and Facebook and all the things on social media. And it was very interesting to me. It was something that, I also like to handle things with balance and grace, because while I'm not afraid to speak out, I truly, as a Taoist, ninth generation Taoist, I am by nature inclusive. We're all human. And so I was very shocked about that. And so I don't usually say it, but here I am because it's important to know.
Yeah.
And I agree. I say, again, in my humble opinion and experience, I'm not totally versed in politics by any means, but what I would say is, and you said it beautifully, is at least this is given a platform, whether you like the politics or not. This aspect to us has nothing to do with politics. It's having a voice.
And most... Secretary Kennedy, whoever else, most people agree on most stuff. Like
Yes.
That's the thing that's crazy. Like
that.
you listen to people that are like super anti-Maha,
Right.
and you listen to them talk, and they're like agreeing on 95% of the things, and they just don't agree on how things are being taken care of, or what they're specifically doing, or maybe what they're focusing on all the time. But we all almost agree now that there's a big problem. We need to do something about it. And so at least at a minimum, I don't care how much you hate Secretary Kennedy, whoever it is, it's a good thing that we're talking about it, because we absolutely have to. It wasn't something that we were talking about before. And
now we are.
We have to find that positive and hopefully, and I think it's difficult these days, but we can find some middle ground over the next few years and take some of the good from, both aspects or both sides or whatever. There's no sides, but whatever you want to call it. But we could find some middle ground for the kids, because ultimately that's what matters. And especially when it comes to vaccines, I'm not against vaccines. We give them in my office.
Let's dive in, Dr. Joel, because
Sure.
Normally what I would love to do if we had hours, and certainly we can spend more time together and have more conversations like this, is kind of understand more about how you got here and what you did. And so hopefully we get there. But let's actually just jump in, because I want to know.
Sure.
And so many people want to know. What are your thoughts on vaccines? What are some of the key points? And I'm going to let you take over here, but I will start by saying, everyone knows my stance. For those that do not, I am of both. I literally was born into this world, East, West, old, new. My father's Korean. I come from a lineage of medicine and martial artists and Taoist practitioners. My mother's American. My point being, even in medicine, Western, Eastern, modern, basically ancient medicine, as I call it, there's a place for both, and it's our job to know. But I, personally, with my 2 boys, vaccinate them. I choose to do it and this is what I would like to know. This is a question as well. I do it in the slow schedule. We used to call it Dr. Sears. It's probably something different now. Maybe it's the same. He started this. I don't know. So I just want to start by saying that. However, there's very few things in this life that make me scared. And I have to tell you, even my own self, because they're my children, when I was about to vaccinate them, I would be lying if I said there wasn't moments where I was concerned. So now you take over.
Yeah, and that's the right place to start, because parents are concerned now. There's no question that there is more concern about vaccines than there ever was. And I think the biggest problem we have right now overall with medicine is medicine doesn't want to talk about it.
Right.
I make that the joke at the beginning of the book. It's like it's called Vaccine Club. It's like you can't talk about vaccines. It's like, that's ridiculous. Like, I should be able to talk about vaccines anywhere and everywhere. You don't have to agree with everything I say. If you don't agree with something, you can point out where I'm wrong. I'm happy to change my opinion. I'm not trying to prove anything. I just want to talk about it.
For 10 years, I've known this about you. That's what I love about you.
And it's not unreasonable to be concerned about vaccines. When we were growing up, there were just a few.
Yes.
Right? When we were kids, you might have had 5, maybe 10 in that range. And now there could be 30, 40, 50 upwards vaccines for kids. And if you're a parent who maybe never thought about vaccines for the last 20 years, and then COVID came around, and now you start thinking about vaccines again, and maybe you had a reaction, maybe you had a friend that had a reaction, maybe you had a kid just recently, and now you're like, wait, how many vaccines are there on the schedule? Like, it's a big question mark in a lot of parents' minds, and generally what you hear is, oh, it's safe and effective, it's great, go do it, it's the best thing ever. And that doesn't make people feel confident when you also have social media now.
Yes.
And you have a lot of people saying, well, my kid had a bad reaction. I'm worried about autism. I'm worried about asthma.
Yes.
We see this chronic disease epidemic. And I don't think a lot of parents know exactly what is good information, what's bad information, what's real. And that's even much more complicated right now with everything going on with all the changes and the fighting and the back and forth that, COVID vaccine is the worst thing ever. COVID vaccine is the best thing ever. And there's like two worlds of information. Nobody ever has debates.
And you're
Nobody
right. It's such a shame. I'm going to make a lot of statements, and I don't usually make statements, but I will make a statement. It's such a shame because then we don't pay attention, which is what you are doing, bringing light. What I know a lot of people not a lot, but there are some of us who are bringing light to it.
And I'm trying to bring, and that's why I wrote the book. It's not to tell people what to do. I don't tell people what to do in the office. I guess that's a good place to start. We have people in the office to do the regular schedule. We have people that do a slow schedule. Some people don't do it. I don't force anybody to do anything. We talk about benefits and risks, and people make a decision that makes sense for them. Everything has a risk in this world. If you get a vaccine, there's a risk. If you don't get a vaccine, there's a risk. And you have to understand that and make the choice that makes sense for you. And what we need is information on both sides, and yet usually what you see is very one-sided information.
Yes.
You have a book about vaccines that says, oh, they're the best thing ever, there's never a problem, and then you read a different book and it's like, these are the worst things ever, you should never take it, and it's really hard for the average parent to know.
Absolutely. And let's be clear, when you are a parent, I'll speak for myself, but I'm pretty sure I'm speaking for most parents, and I already said it, I can be so balanced and broaden my perspective, everything I preach, I practice on so many topics. But there is definitely something, because you're so emotionally attached. I mean, we put them on this earth that when you even hear one thing that could possibly cause harm, it's very difficult to balance through that.
It's very hard.
I'm communicating this properly.
Medicine doesn't have respect for that. You have a healthy baby,
right? And
within a couple of hours, you're like, all right, well, here's the vaccines that we want to give your kid.
Yes. Okay. So I don't want to cut you off, Dr. Joel, but I don't want to forget. Let's backtrack for a second, because that's an actual specific question that I want to just, open up. But before we both talked about the slow schedule. So for people who don't know what that is, what is that? Hi, everyone. I'm Dr. Janelle Kim, 9th generation doctor of Eastern medicine, founder and formulator, manufacturer of JBK Wellness Labs, martial artist, and practitioner of the Tao. I am so grateful for the opportunity to have this podcast, The Experts. The intention behind this is to, my favorite thing as a Taoist, as the Taoist beauty and longevity expert that is, my favorite thing is to take away the complication. Why make life harder than it has to be? And so what I wish to share in this life are practical and effective tools that have been passed down in my lineage, but really in ancient medicine for thousands of years. So the point behind this podcast is to bring you the experts. So you truly have a place to come for all things on the 3 pillars: medicine, movement, and mindset. And so in appreciation for all of you tuning in, I would love to offer you a promo code, DJK, Dr. Janelle Kim, DJK15 for 15% off my new collection of products, core collection of some of my favorite products. You know that I manufacture for brands carried in Credo, Sephora, Ritz-Carlton's, Nordstrom, you name it, for over 20 years. And these are some of my favorite products. It's a beautiful face serum, face oil, and a muscle and joint product that was launched at the NBA All-Star Game. I'm grateful. And these products have been handed down in my lineage, these formulas, for 9 generations. I combine them with the best longevity ingredients that exist, and I cannot wait for you to try them. And also, you are able to use that code for any of my moving, meditation, or Qigong courses.
And to start with that, so the regular schedule, every country, different locations have a schedule that's recommended in their country. So for America, it'd be the CDC recommended schedule. And that would be what has been researched and studied to be the most effective, best schedule, the recommended schedule in the country that for public health reasons is recommended.
Yes. It's usually that little green or yellow printout sheet.
It's a sheet with like the lines.
So big with all the circles.
The circles and the ages. So it would be extremely arrogant of me to say, oh, Dr. Joel knows better than the CDC, right? And I never do. I never say such things because I think that's super arrogant. Lots of people have studied these things for a long time, and they have come up with what they feel like is the best schedule. So that's the only thing that's recommended. Anything outside of that becomes personal choice. And if you want to do a slower schedule, that is the slow schedule. There is no one slow schedule. The one you mentioned, there's the vaccine-friendly plan, there's Dr. Sears. Those are some of the original books that really discussed some alternate schedules, basically means going slower. And that can mean multiple things. So if you're doing, let's say, vaccines at 2 months, 4 months, and 6 months, and doing multiple on those days, slow schedule could mean, well, I want to start later. So instead of doing a vaccine at 2 months, maybe I don't want to do any till my kid's 6 months or a year or 2 years or 3 years, whatever you choose. Or it could mean I don't want to do multiple vaccines on one day. So I'm going to do one at a time.
That I paid a lot of attention to whenever possible. Like I have to think back now, 12 plus years for my Vince, my oldest. But I remember being kind of adamant about that for my own personal choice. It made sense to me, right? Like they're growing beings. It just makes practical sense to me and in my life right now that if I can kind of break them up. And I remember one of the things that I did consider for a second is, the reality is now you're bringing your baby in, your child in to get that many more shots. And it's not a wonderful experience for them, a choice I had to make. But ultimately for their growing bodies, mind, body, I decided to do so because it made sense. I still went ahead and did it, but I separated it. It also takes a lot more time. And
yeah, a lot of people have to do that. A lot of people have us do that.
Yes.
The schedule, again, it's set up in a public health sort of way because there are a lot of people that just can't get to the doctor's office that often. Mm-hmm. It's hard for them to get in, can't financially get in, they have to go to work, whatever it is. So it's just not that easy to go in every month or every couple of weeks to get a vaccine. So you get a bunch on one day.
Absolutely.
And that's where it is. Now, if you have the means and the access, could you break it up? Of course you could. Mm-hmm. The risk really would only be if you're just going slow, that if you happen to leave one, let's say there's 3 vaccines at 2 months and you said, I'm going to do only one of them today, you could get that disease in the next month that you didn't get a vaccine for. So you do add a little bit of risk, or it's not a huge risk, but that's really your risk. Other than that, a lot of people in my office, they do them all. They just go slow. They do one at a time. And there's no, unfortunately, research about that, right? That's what we need. We need to look at the research because the question is that better?
Right.
Is it safer? Does it decrease your risk of reactions? The answer is we don't really know, right? We don't really know. It's not really been studied. I think from a common sense perspective, a lot of people would say, well, you're only doing one thing versus 3 things. And so your body can probably handle one thing better. Mm-hmm. If there is a reaction, it's only one versus more of aluminum or more of any chemical. And so therefore, maybe your body can handle a little bit better. So that's the theory behind doing it. Whether that's true or not, hard to say.
Absolutely.
But that's why a lot of people choose to do it. And I don't have a problem with that ultimately. I think if that's what makes a parent comfortable and confident to do it.
And it did for me.
Then
also, I can speak my own personal experience, right? And and also another reason for me to be totally transparent and try to remember, to be honest, is, my Vince, my oldest, I don't want to use the word react, but ultimately he was a kid that every single time I did a live vaccine, right? So that's another question, the difference, right? He would definitely get a fever. And his whole life thus far, knock on wood, he's very, very, rarely ever gets sick, right? And I knew that would come, and that was part of it. So I knew, and that could be part of the immune system doing everything it's supposed to, I will acknowledge. But that is something that I personally looked at, is that when I went to give my boys their vaccines, I would do the best of my ability, because it mattered to the way I look at things, to do only one live vaccine per, let's say, visit or vaccine that I needed
and
to give them.
To me, that's totally reasonable, right? First of all, a fever, it's a regular immune response. So you would, you'd expect that. That's a pretty common thing that you get. But I think what you're getting to here is maybe more intuition or just a knowledge of your own kid.
Yes.
That, maybe one of your kids is more sensitive.
And I appreciate you saying that, because Jackson, my little one, that did not happen.
Right, and that's where the nuance is just totally missed in medicine. Because if you do have a more sensitive kid, then what is the issue with that kid going slower or being a little more cautious just to make sure that they're not having a reaction? You can have a reaction from a vaccine. Why could you not? We know that. That's
absolutely
documented. Kids have reactions. It's not extraordinarily common, at least the serious
reactions. They give you
reactions.
handouts with all of this information when you're there.
So if you have the kid that's already had a reaction, or very sensitive, then to me, logically, those are the kids we should be studying. Those are the kids that we should be more cautious with. Those are the kids we should be going slow. And then the other kids are the ones that maybe they can do the regular schedule and they can get 20 vaccines and they're going to be fine. But there are other kids that they're more sensitive, and that's genetics. That is what we need to be studying. And it frustrates me a lot that instead of just saying safe and effective, we don't say, well, let's figure out who the kids are that have the reactions.
Yes.
Let's figure out why they have those reactions. Let's look at the genetics. Let's look at the environment. Let's look at everything on these kids. And maybe one day we could have a swab or a panel and be like, oh, well, these are the kids that have these genetics, and they're the more likely kids to have a reaction. So that's the kid we don't give this vaccine to, or that's the kid that we give it to them when they're 4 instead of at 2 months old. That is something we could do later. It's not about pro-vaccine or anti-vaccine. It's about how do we do it in the safest way possible? And it's so frustrating that we never talk about safety, or very rarely talk about safety with vaccines. It's just do it. And the only thing we talk about is we need to protect from diseases. And we do want to protect kids from disease, but we also don't want kids to have side effects. So you want to balance those two things. And the only way to decrease side effects is to acknowledge that they exist.
Yes.
Study that and try to minimize it over time.
Absolutely.
And right now, the way that things are set up, it's very skewed towards just doing it versus thinking about making them better. Because there's no...
Which is part of the whole wellness longevity journey.
Who's making vaccines better? There's no... Is a company who can't get sued, which...
That I wanted to talk about.
Sure.
Because that's the whole thing.
Yeah. So so for vaccines, there was a...
And this is just fact. This is not our opinion. Factually.
In 1986, the Vaccine Liability Act got put into place. There were concerns around some of the vaccines, especially the diphtheria, tetanus, pertussis vaccine causing neurologic conditions. There were a lot of lawsuits, and several companies went out of business or just stopped making vaccines out of concern for all the lawsuits. And so they decided, well, we still want vaccines, so we want to give liability to the companies, no liability to the companies. So if there is an issue, then you don't sue the company, you sue the government, and they have a program that will be in place to compensate those individuals. So now we have a system, for better or worse, that you don't sue the companies. They have no liability, so they have no reason.
Much different than other medicines.
Right. Everything else you would sue the company. I mean, anything else. If you have a problem, you spill hot coffee, whatever, you can sue the company. For better or worse, also in America, probably sue too much, but that's the checks and balances that we have here. And for vaccines in general, you can't really do that. So is a vaccine company going to say, now that they have no liability, well, let me study my product. Let me see if I can find a problem. If I find that problem, I'm going to take my multi-billion-dollar product off the market. No, of course they're not going to do that. So who's studying these things to make sure that they're safe long-term, or that there isn't a way to make them safer or better? There's nobody doing that, and we have to make sure that happens. So I think right now we're in this place where there's nobody really trying to make the current schedule better or safer, and it just seems like there's more and more vaccines without a discussion about safety.
Yes.
And I think both things are important. Again, going back to, we don't want kids to get measles, but we also don't want kids to get a reaction from the measles vaccine. Both things can be true at once.
Yes.
And there are always ways to make things better, and we shouldn't have arrogance to say that we have the very best vaccine schedule in the world, or the very best vaccine schedule that's ever going to be. We couldn't make it better. We couldn't make it safer. Of course we could. We want a safer, better schedule in 10 years than we have now.
Yes.
And we can only have that by talking about it.
Yes. And also, how do I put this? Vaccines are ultimately meant to stop transmission of certain diseases. And there is understanding out there, you can respond however you wish, Dr. Joel, that that's not always the case by any means. And so that's an interesting take then, because then you're like, why do we take these vaccines? Once again, I vaccinate my children, I get it, but it is the practice of taking a pause and thinking through the decisions that you're making ultimately. But that is an interesting one.
It is. I would just alter one thing a little bit there. So
yes, please.
I think that the main goal of a vaccine should be to stop transmission.
Yes.
I mean, that's the best kind of vaccine, and very few of the vaccines actually do that. The other major goal in general for vaccines is to minimize your serious risk from the disease. So minimize your risk of death, minimize your risk of serious disease putting you in the hospital. So you don't necessarily have to stop transmission for a vaccine to be effective. I mean, the overall goal is to give you a little piece of something, or expose your body to the disease before it actually gets the disease. So that way it mounts an immune response. That way, if you get exposed to it in the future, you don't get that sick. Ideally, that stops you from ever getting sick, or stops anybody from ever getting it again. But most of the vaccines don't actually do that. That doesn't mean the vaccine is not effective if it just protects you. I mean, it's still a good thing if you get exposed to, tetanus and you don't get tetanus. That's still a good thing. Or the measles vaccine, if you get exposed to measles and you don't get measles. But it doesn't have to stop transmission. I think that's the intention.
Yes.
But a lot of vaccines actually don't do that.
But even that, I think it's important just for people to be aware of that. You know what I mean? And again, make your correct decision, your wise, whatever you wish to move forward with, but just know what you're doing.
It is such a great, important point, because especially when you talk about places like California where there are school mandates, there are many...
My son, I thought I was all caught up, and truly this is just my schedule. That's the honest. I mean, I care about their health, every single moment of their day within balance. But the school called me and they said, Janelle, unfortunately, Vince can't go to school because he needs this one shot. So of course, I was like, okay, I'm going to get the vaccine, but that's the way it is in California. I don't know how it is elsewhere.
Yeah, every place has different rules. California is pretty strict in terms of their rules. But
Yes.
if you're going to require vaccines for school, you would think that the things that should be required are the stuff that actually protects other kids.
Yes.
And there are several vaccines that don't really protect other kids that much. They
That's
just
what I'm
protect
saying.
you. So something like tetanus, it's in the soil. So it's not, everybody can have tetanus, but it only matters if you have it, if you're going to get it. It's not protecting anybody else.
Yes.
So that doesn't mean that you shouldn't get the shot. It just means that you would think it shouldn't be
More of
required
your
for
own
school.
choice.
It should be your
Yes.
own choice. If you're going to require things for school, which I don't think you should. I think, everyone should be able to make a choice. And that's my personal opinion that most people get vaccines. Most places in the country and around the world don't require vaccines to go to school. They recommend them. And the amount of people that don't get vaccines is pretty small. It's like 1%. And so for those people, I think you should have personal choice, especially with religious freedoms. I think that's a surprising thing for me that vaccine rules ever got there, because especially in America, religious freedom on everything else.
Yes.
And I'm not like particularly religious, but I think on every other thing, religious freedom kind of supersedes it.
Yes,
and
it has been since our founding fathers.
And in the vaccine world, in some states, you're not allowed to have a religious exemption for a vaccine. So I think that's just an interesting dichotomy there, which I think there's kind of a pushback. I feel like religious exemptions are probably going to come back everywhere based on the direction of the lawsuits that are moving. But
we shall see.
We'll see where it goes. But either way, I think people should be able to choose. And the job of the CDC and your doctor is to make a recommendation. It's literally called the CDC recommended schedule, not the CDC forced schedule.
Yeah, that's a good point.
And
words matter.
and
they're thought through at that level.
I think we shouldn't be stopping kids from going to school.
Yes, understood. Well, Vince almost didn't go to school, but I had to move quickly. Okay. Okay. So much to talk about. Let's move on to, for a moment, the rise of chronic disease in our children, particularly obesity, allergies, autoimmune disease. I know I was at one of your book launches, and you gave a beautiful kind of talk. It was more intimate, and you gave some statistics or data points. And although I'm aware, it blew me away. And you said it with a bit of humor, which I love, meaning you made it light, even though it's not light. I have to appreciate that about you. I do the same. It's important. It's balance. But can you name some of those? I'm not putting you in the spot, or some points on this, because it's surprising.
It is really surprising. It's not surprising if you've seen this over the last little while, but it's really surprising that we're not talking about this more, because it's so staggering. It's about 50% of kids with a chronic disease.
Yes.
Chronic disease meaning the things you mentioned, autoimmune conditions, allergies, autism, ADHD, all of those types of conditions.
I'm sorry, 50%.
50%. It depends on which study you look at, but it's somewhere between 40 and 60.
Yes,
it's a huge proportion.
Yes.
So let's just say 50. That's 1 out of 2 kids. I mean, that's insane. If you have 2 kids, that one's going to have a chronic condition that probably needs medication. That was not like that. If you look at the statistics, 50 years ago, it was like 5%. So that's a huge increase in just a few decades. And similarly, diabetes, right? We have pre-diabetes, and diabetes is like a third of kids. Which is insane. But autism is probably the most insane.
Yeah.
You go back just a few decades and it almost wasn't existent.
And by the way, I have that is actually very close to me. I have a child in my life incredibly close to me who is on the spectrum, and pretty extreme, So
and
I just want to acknowledge that.
The numbers keep rising every year.
Yes.
I mean, it was 1 in 34. Now it's 1 in 31. In California, it's 1 in 12.5 boys. That's a staggering number from the last year, like 1 in 12.5 boys. And
that means that in one classroom, let's just think about this. Let's say in one classroom of 24.
Yeah, like two or 3 kids
yes.
with autism.
Like, let's just picture this.
There's just no way that was true. And it's really also unfortunate that we have to have this kind of political back and forth about this topic as well. And there has been a lot of it lately because, there's the majority of people are like, look, it's happening more. And then you have a group of people that say, no, it's not happening more. It's
or
just
maybe we didn't recognize it before.
Maybe we didn't recognize it.
Right?
It's like, no, that's just such BS. I'm sorry.
Yes.
Absolutely, we didn't recognize this as much before. Absolutely, we're much better diagnosis. Absolutely, we're much more aware. That is certainly a portion of it. No question about it. But it's happening more.
Yes.
Way more. You don't have 1 in 12.5 adult males with autism, even mild autism. And severe autism is much, much, much more common. That's like a quarter to a third. We're not missing thousands of kids back in the day that were nonverbal and were stimming and having all the issues that the severe kids with autism have today. And so I just think that's unfortunate because, yes, we can be better diagnosing it. And yes, we certainly didn't recognize all the more minor autism back in the day, and some things were classified as something else. But it's still nothing like we're seeing today. So there's something, probably many things going on, and we deserve it to those kids to start to figure out what is going on. So that way, for the versions of autism, which I think it's many things, that it is environmental. Maybe there is some or many things that we are doing in our society today that we could change or alter to minimize those symptoms, to help those kids. There are a lot of families.
Which, by the way, some of them are actually happening right now. That I very much pay attention to.
Yeah.
It's not an easy road, but...
No, I mean, we're definitely talking about it for the first time. But again, it's just so controversial to be talking about it. And it shouldn't be. It should be, we don't know exactly what causes it. We have some theories. We understand there's some genetic components. We understand certain things that are showing that they're correlated with it, but we don't have a perfect understanding yet. And we should be open to everything, including vaccines. It should be on the table, and we should be able to continue discussing it.
It is true. What other things? I'm sure there are. So forgive me, everyone, because I don't have a list. But in this moment, I sit and think, like, what other important aspects of like the human condition and life are we just literally not allowed? I didn't even say that, but I'm saying it. Allowed to talk about.
Right. Why can't
and it's the health of our children?
Right,
like,
exactly.
What is more important? I am sorry.
It doesn't matter what your opinion on vaccines are. You could be like, vaccines don't cause any problems. They never do. That's fine. Okay, so prove it. And if you have that opinion, then there should be no reason that you have an issue doing research on vaccines.
Yes.
Like, what you want more science. Literally the thing that's going to be the most helpful for vaccines in the long run is going to be getting the actual research and data that people want and feel like are missing to give you that evidence, right? We don't have vaccinated versus unvaccinated studies. They haven't been done. We haven't followed kids forward. And if we do find that there is an issue, wouldn't we want to know that so we can make changes? Not to stop all vaccines, but if there's some component of a vaccine that's triggering asthma or making it worse or increasing your risk, why wouldn't we want to know that?
Absolutely.
I would say, okay.
In fact, I know it would bring that many more people together. That many more people would be on the same page.
Imagine you found that aluminum vaccines increase your risk for asthma 10 times.
Right.
Just imagine you found that if you did the prospective study, follow kids for 10 years, did it over the world, and you found that. You'd be like, okay, let's find a different adjuvant. Yeah. Let's do something different. Let's see if we can change it. Doesn't mean you stop vaccinating for measles. It'd be like, let's see how we could change the vaccines to get that protection, but minimize the risk. Or you do those studies, you follow kids forward, you do 10 of these studies that are really, really good, you find no problems, and then you say, all right, here is the evidence, parents, that shows you, look, you're worried about autism?
Yeah.
You don't see it. You're worried about autoimmune condition? You don't see it. That's going to get people to do vaccines. Like, now we have hesitancy. Now not talking about it is actually creating that hesitancy. You have the highest rates of unvaccinated kids ever, the highest rate of exemptions, the hesitancy's through the roof. Nobody trusts medicine anymore. Nobody trusts doctors. People aren't going anymore. Medicine is creating that very thing because they're not willing to talk about it. And you just say things like safe and effective versus risk versus benefits. And here's what research we have. Here's what we don't know. Let's continue to research those things that we don't know. We don't know a lot.
It just is.
There's just so little that we know about long-term risks for vaccines. We have not studied that. That's not how vaccines are studied. They're studied for the most part before the vaccine comes out.
Right.
They're studied by the company for the most part. Right.
Which, by the way, they're not liable. Again, I'm not one. Everyone knows me. I'm not one to keep. But let's see the facts.
They're not liable. But either way, if you're a company trying to get a product on the market, obviously you're going to show things in the best possible light.
Yes.
When doing that research. So you have to take that research with a grain of salt. That's what it is. Yes. And then, people do study them post-market sometimes, but who's studying them for 10 years? Who's studying for cancer? Who's studying for 50? Like, how do you know? There's no mechanisms to study those things. We always talk about autism. People say, oh, the research is settled. We have not studied the vaccines prospectively, vaccinated versus unvaccinated kids, so we don't know. There isn't definitive research to show that it is related or is not. It just hasn't been studied in the way that we have been taught that you would think that it would have been studied.
Yes.
So you just have some epidemiologic studies, and mostly it's just about MMR and thimerosal, not all the vaccines. What matters is all the vaccines. If you get more and more vaccines, does that increase your risk to anything? Maybe it does, maybe it doesn't. I don't know. That's what we need to study.
Right. Yeah. I'm very grateful for all of this. And you have children yourself, right, Dr. Scholl? And like I said, I'm going backwards here because normally I would ask you. So I am interested, and it always means a lot to me to know this about whomever I am speaking to. Like, so you're born in Toronto.
Right,
Did you always think that you would be in the medical field? Did you always want to? Maybe not always, but since you were young, is this what you, not necessarily this, but what did you picture your life being like?
I mean, not this.
Yes,
not
I know,
really,
right?
but actually,
oh my
that's
gosh,
for sure.
Tell me about it. That's one of the reasons we're so grateful for you.
Yeah, when I grew up, I was pretty, normal. I was not holistic minded at all, that's for sure. I mean, just, regular life in Toronto. I loved working with kids. I always did. So I started coaching my brother in baseball and hockey. That's kind of how I got into working with kids, and I just enjoyed doing it. So I was working at summer camps and ran summer camps and enjoyed that. I like science too. So when I got into med school, it was just to become a pediatrician. I like working with kids better than with adults.
Understood.
So that's why I went into working with kids.
Yes.
But, I went to very mainstream programs. Like I was at Children's Hospital Los Angeles, like as Western as you could possibly get. A top 5 Western program.
Yes.
Is very good.
I hear you. I know this.
And, I think it's my wife, really. Like I met her. She's very holistic minded, kind of opened up my eyes to a different perspective.
That's beautiful.
Eating healthier, a lot of that kind of stuff that just opened my eyes. And just seeing people go outside the system and getting better and being told like, oh, you have this condition, you're going to have to take a medication your whole life. And then they come back and they're better. And you're like, well, what did you do?
Right.
And so I started learning some of that myself, started learning functional medicine. You take some courses, and you're taught in medicine, like, oh, this is all woo, it's all crazy. And then you go do it and you're like, wait a minute, like, why are we not taught this stuff?
Yes.
It's not woo-woo at all. Like, what is woo-woo about thinking about diet or nutrition or root cause?
And also, what is woo-woo about something that has existed for thousands upon thousands of years is my favorite.
You can be very woo-woo in integrative medicine. You certainly can get out there, but the basics of it are not in any way woo-woo. They're the things that we should be learning, and they should be integrated.
Well, that is wellness, and that is longevity and all the things that we're talking about now.
But that's what led me into vaccines, right? Because it wasn't that I was like particularly interested in vaccines. I mean, you go into med school, in residency, and you're taught, all right, well, here are the horrible diseases we used to have, and we don't really see them anymore, and that's because of vaccines, and vaccines are the best thing ever, and here's your schedule, and go do it, right? And that's all you think. Like, you don't really think to question it. Nobody really discusses vaccine safety. So, I didn't think about it. You just go do it.
Right.
But if you're going to do integrative medicine, then you're very quickly bombarded with vaccine questions. And people come into my office were, very interested in having discussions around vaccines, and we're more hesitant about vaccines. And we're more educated about vaccines, and same with social media. I get a lot of questions about it, and I started to have to learn and start to look things up. But even with what I had learned, I still didn't really know the answers to a lot of questions, or wasn't sure about them. So that's what really led me to want to write the book after getting really frustrated with everything with COVID, but also just, if I was going to talk about it, I felt like I needed to be as educated as possible.
I love that.
And so that's what led me to write the book. And so, I would have never imagined even 5 years ago writing a vaccine book, but it was, I thought it was needed because I don't think I could talk about this topic without having done the deep dive, because you can't say things like the research on autism hasn't been done when it comes to vaccines unless you've looked at it all.
Yes.
And I have, and unless I've missed something, which I don't think I have, because thankfully I did a master's in epidemiology. I didn't know why I did it at the time, I guess, but now I know.
Yes.
Very helpful for
happens,
this.
Right? Yes.
But you have to look at everything and say, okay, here's what we know, here's what we don't know, here's the BS, here's the not BS, and here's what we just need to do moving forward. And with all the autism discussion, we need more research. That's the answer at the end of the day. A lot of the stuff we just need more research. We are missing a very important piece of the puzzle with vaccines, which is how they affect you in the long term.
Yes.
I think we have a good understanding of the protection you get from vaccines. I think we have a good understanding of the short-term effects. I don't think we have a good understanding of the long-term effects. And that is the missing piece that's really important when you're talking about risk versus benefits.
Yes.
Because you want to protect from a disease, but you also don't want to create more problems than not getting a vaccine. So there's a happy medium there. And without having that understanding, I think we're missing that piece to make a decision for a parent. And I think that's the information that's really needed to balance the scales in terms of making decisions for vaccines. And I just don't know that we have that yet.
I hear you. Well, let me put it out into the universe. Let me put it out in general that by the time our children have children, maybe this will be that much more balanced in that way.
I think so.
I do
think
seems like we're moving in that direction.
We're moving in that direction. Mm-hmm. We'll see.
Finally.
I know that we're talking about it.
Yes.
I know that there's discussion about doing more research on it. How that research is done, how fairly it's done, we'll see.
Yes, understood. Okay, so obviously all of this is along the same lines, but actually, no, I want to ask you a question, Dr. Joel. What does integrative medicine mean to you? Like, I know what integrative medicine, someone asked me this question, I like this. Like, what does it mean to you?
I get asked all the time. To me, it means balancing the best of Western medicine with alternative or holistic medicine. I think it's just bringing in all of the different modalities that are available to us in the world and doing whatever makes sense and what's best on that day.
Love that. And then you started with the word balance, exactly why we're friends. It's the truth. Okay, so then moving along, it's very interesting. I have some of my own responses and thoughts on this, so I'm not just putting this on you, but it is interesting because we are now living longer and kind of same, but moving along this conversation. However, we have this serious, very apparent like rise in all of these diseases, particularly with our children, but also adults as well. So what other factors, right, are there? We know this, but I think there's a lot of people out there who are not really aware or maybe don't want to see, but let's just say them, that do affect our livelihood, even if we live longer.
Yeah,
are sick.
It's such a great point because I talk about this a lot too. And I think it is, kind of funny because, you talk about like life expectancy and then you're like, oh, we have all these problems. And then people are always like, oh, but you used to live till 40. It's like, okay,
right.
That's true, right? There are a lot of things that we do better now than we used to. And so, yes, our life expectancy has increased from, 40 to the 70s or what, depending on the country. But it started to go back down for the first time ever, right? And so over the last few years, it started to decrease. And this is the first generation of kids that potentially could live a shorter life on average than adults. That's never happened before. So I think that's a big concern. And the other big question is...
And you don't really ever, maybe, I have not heard exactly it in that, but also I'm not, as versed in hearing all the things.
Yeah, and I think that's a big deal.
We
right?
should be hearing a lot more, is my point.
Because you would want, just because we live till 70 doesn't mean we shouldn't be living till 90 on average, right? And there are places around the world that do live a lot longer than we do. So you have to say, okay, well, this is the job of health, right? Or public health. How do we make our population in general healthier? How do we make them live longer? And not just longer, but healthier longer.
Right.
And just because we're living till 70, but everybody has a chronic condition, that's not necessarily better.
Yes.
So we are in that position now. And that's why it is so important to discuss these things, because we want people to live, we want our kids to live longer and also be healthier. We don't want them to have more conditions.
Quality of life, not just quantity, right?
Exactly. And that, overall, from our public health body should be the number one question. Like, what are we doing? What did we do in the last 40 years? What are the changes? What's going on? Why is this happening? I don't think we know. Like, we really don't know. I think we have a lot of theories, right? I think it's our food and our toxins. I think those are the big things, right? But exactly what it is, no, we don't exactly know. Right. But we have crappy food. We're not eating locally anymore. We're not eating fresh food. We're not getting the nutrients.
Which is huge. Food is, I will always say, I do all the medicines, right? The skincare, I make this stuff.
But there's only so much you can do.
Food is the best medicine.
Right. You're literally built of what you eat. And if you're not getting the nutrients and if everything's sprayed in a million chemicals, even if you get the best food possible, it's been shipped in from some other country. It's picked 2-3 weeks ago. It's not the same thing as what we've been eating forever. So I think that's a big factor that needs to be really looked at, and how we can get more fresh local food, and also just all the chemicals and toxins. And that, again, going back to Maha, that's a big issue. I think there are a lot of chemicals and a lot of toxins in our food and in our water and everywhere that just have built up over the years that we just have no idea what it's doing to us. And we have to start to peel that back, which is a very difficult task to do.
Yes. I appreciate that. And I could agree more. It's the chemicals. It's the food that we are eating. I'm repeating right now. It's, all chemicals, meaning artificial flavoring, artificial dyes. Same conversation that I have in the beauty industry. That's the truth. And wellness in that way is just all of the unnecessary things. And the way I love to acknowledge it personally, because it's my favorite thing to make things less complicated, because we love making things so complicated for ourselves, is that our bodies are miraculous and they know what to do. That is a thing. All of us agree, no matter who we are. And so to me, why wouldn't we do everything in our power, although it's not always easy, to use the best or the clean beauty products, right? Natural, to do our very best to not eat processed, chemical-filled, artificially dyed, artificially flavored foods. I like to think of it as, because our bodies are that miraculous, and like anything else, we have to acknowledge that no matter if we're sleeping, sitting here talking, our bodies are constantly having to balance with what is around them. And so why can't we just make it a little bit easier for our bodies? Do we not care enough? Just because anytime you put in those chemicals, those synthetics, the processed foods, it's just that much more difficult for our body to function.
Yeah, no question.
That's the way I like to look at it.
And that's the way I look at it too, is everybody can handle some. Right? Our bodies are amazing.
Everything in balance. My kids know how to eat very healthy, but I tell you what, Dr. Joel, people may or may not like this. If they'll have a bag of Doritos, I can't stop them. They like it, or these Takis that are out there.
Right, but it's balanced.
But they know to look at that. They do. They know certain ingredients. They know that is not good for them.
Right. But if you eat it once, it's not the same thing as eating these things every day.
Absolutely.
And that's where we are now. And that's why, of the good things that Maha has done, again, it's like there has been a lot of awareness around some of these chemicals, right? And I think that's a very good thing, because I think that for so long, people weren't even thinking about what they're putting in their bodies or what they're putting on their bodies. And so just to think about, well, what dyes are on here? How much sugar? Which kind of sugar? All those things, it makes you look at the ingredient label and start to understand.
Yes. Just be aware. Yes.
But on the flip side, and I also agree with this, that doesn't matter that much, right? Not at the end of the day, right? Those things, like if you eat natural food dye versus a synthetic food dye, a crappy food, it's still bad for you.
Yes.
But at least if we're starting to have the conversation, I think that's a good thing.
Then people need to look, right? It's not blind.
And then there are next bigger steps that hopefully need to happen over the next decades. It's not easy things, but we have to change the food system. We have to change the incentives. We have to change the regulations. Like there are a lot of big things that need to be done for people to truly get healthier, I think, in the long run. But it starts with you and it starts with the little things.
Always.
And so awareness is hugely important, and there has been a lot of awareness raised in just a year or so.
Absolutely.
And that's good. I think that part's all good. And I understand the critics, and that's fine. And I agree with most of the criticism, honestly. But I think that it's such a big task to fix health.
Yes, of course.
We're so much. We've had such a corporatized health and food and everything that it's going to be a lot to untangle it. But it's good that we're talking about it. And we couldn't talk about vaccines a year ago. So this is great. Like that's the first step. I mean, it's not going to change overnight, but at least if we can have conversations and people can argue about it, and that's fine. And if people are arguing about it and debating about it, then we can actually get to a place that's better. And again, I go back to, you don't have to agree with me. If somebody thinks there's something wrong in the book, whatever, send it to me. I'll change my perspective. I don't care. I'm not trying to get people to do anything. I'm just trying to have these kind of conversations, because this is what's going to change things in the long run. We couldn't talk about vaccines. You want to have it something different in the future, you have to talk about it first. That's the first step. People have to understand that there are concerns. And even in the mainstream medical world, I have seen it starting to change. Like doctors are being forced to talk about this. Patients are requiring them to talk about it. They're bringing up questions. I've had conversations with very mainstream doctors that have not, yelled and screamed at me. Right? There's been very cordial conversations, which I did not know was going to happen. Right? And so it's just it's a different world. That's good. I think that's all good, and we're moving in a better direction a little bit.
Absolutely. Well, I talk about the 3 pillars, the 3 M's: medicine, the importance, and this is how we achieve longevity, beauty, all the things that have been passed down for thousands of years. 3 pillars: medicine, movement, and mindset. Mindset is how we think. And I've heard you say several times, so I just want to acknowledge, and maybe this is a nice way to unfortunately kind of conclude, because I want everyone to know where to find you as well. But in the mindset pillar, I speak of the 8 keys of living meditation. The 3rd key is called stop being drunk on your own thoughts. So I'm really going out there right now, going on a limb here. And I think it's one of the most important, and I've heard you say it, and it's one of the things I love the most about you, is because you certainly do not do this, which is one of the most dangerous things, as the ancient teachers have taught. My greatest teacher, this has been passed to me when I was very young in different ways, the most dangerous thing can be our mind. The most dangerous thing is literally being drunk on our own thoughts in such a way that we cannot even be open, that we cannot even broaden our perspective and zoom out to see more clearly. And isn't that our ultimate goal, whether we forget it, whether we choose to do it or not as a human being, is to have that, because that is what ultimately gives us mental, physical, spiritual, optimal well-being and longevity. And so that is what I'm hearing you say so much, is like the time of key number 3 of living meditation. Stop being drunk on your own thoughts, because it's going to really damage your life. And also, and to me, even worse a lot of times, first is yourself. Know your true self is key number 1, but then how you are affecting others, And I'm very, very grateful for everything that you are doing. Your social media, by the way, I love. As much as I'm on social media, and I'm not on so much for my own personal, but there are certain people that I will always do my best to try to watch, and you are one of them. The way you present things are entertaining, which is very important, but to the point and always balanced. In my humble opinion and experience, I tell everyone about you. Everyone should tell everyone about you. Your book, Between a Shot and a Hard Place, which I love that title. And when you sent it to me and said, Janelle, do you want to share this? I was so grateful that you put this out into the world. So where can everyone find your book? Where can everyone find you? What kinds of things are you doing right now? All of the things, Dr.
Sure. Well, thanks again for having me on. It's always great to see you. And so Between a Shot and a Hard Place, you can find it, all the regular places books are sold, Amazon, or you can go to theshotbook.com. Or you can go to my socials at Dr. Joel Gator, and everything's linked there.
And we will have the same on this episode on YouTube and all the places.
I'm doing I don't know. We'll see. I'm kind of in between right now. I'm not writing another book at the moment because I need a break.
Yes, here you go.
But I'm trying to do more advocacy stuff right now. So that's what I've been working on. And, I've been involved in some Maha stuff. I don't know. Again, it's weird to say because it's like, I went to the Kellogg's rally.
Yes.
And I was there originally with Vani Hari, Food Babe, to fight against the dyes. And I got to know a lot of those people who have become very influential in Maha. So I've been able to be
I'm really
involved.
going on a limb. Who is against that?
I don't know.
You don't have to answer, but like, why in the world?
Well, I don't know people are against that. I just think they're
Yes.
against some things or some policies or,
Sure, that's fine.
I think the biggest criticism right now has been, well, there's a lot of focus on these little things, but maybe not on some of the bigger things. Or some of the bigger things have been going the wrong direction. And then some of that criticism is true. But also it's a big thing and not one person is in charge of the government. So like there are different parts of the government doing different rules and different things. And so you could be fighting for food dyes while SNAP program gets changed. They're different parts of the government. But fighting for kids' health should not be political.
No, that is what I'm saying.
I'm happy to be involved in Maha or whatever it's called because it's helping kids. So that's all I care about and not about a political thing.
Well, we are on the same path together. I care about that too. Exactly. So thank you so much. I cannot wait for our future conversations and collaborations. We met on, what was it? Why Am I Raising Amazing? It was a parent show. We were introduced by Serena Vincent, who's like a big sister. She's amazing and beautiful and all the things. So I believe that's how we met.
Hi, Serena.
And here we are. I know. Hi, Serena. I had to she's so important to me that I just have to, give her a call out. But yes, so grateful, so amazing to see how far you've come. And I can't wait to see how much more you will positively influence the life of our children. So thank you. Thank you, everyone, for joining us. And please make sure to share this information, to subscribe, and let's get the word out there so that everyone can just make a correct choice. And that's really what it comes down to. As Dr. Joel said, we can agree that we are not here to convince anyone of anything, but here to do our very best to make ourselves the most informed, educated, and share everything that we can so that we're all on this page together, because life is beautiful and can be long, but life is short. So why wait? Thank you so much. Thank you, Dr. Joel.
Thank you.